To comfort always. That's the mission of Hospice of New York. Serving patients and their loved ones throughout the New York area since 1997, Hospice of New York offers comprehensive, compassionate end-of-life care. Hospice care is that something extra that can always be done at a time when other healthcare providers may have said that there was nothing else they could do. Hospice focuses on maintaining the patient's quality of life through expert control of pain and other symptoms, while providing the best in comfort care. Marie is a typical hospice patient. Let's listen in on a conversation between her granddaughter, and their hospice nurse, Lori.
Marie, what reassurance would you give people that were thinking about coming on hospice? Maybe they were concerned about coming on. What would you tell them to reassure them about coming on to the hospice program?
Oh, be sure. Please change your mind to sureness rather than I don't know, or maybe a later date. No, don't wait. Start now. Start now for this help because it's out there for you in abundance.
How has it been for you since you've been home?
With the help that came in to help me, God bless them. That's all I can say.
Once your grandmother was home on our program, was there anything that surprised you or
Oh, yes, it did. I spoke to you in regard to getting my grandmother equipment, and you advised me, that she'll be well taken care of, and you said we also get supplies. And when I went home that evening, after she was discharged from the hospital, around 7 o'clock, 7:30, we got a doorbell, the doorbell rang, and all her supplies came. Her hospital bed came the following morning, friendly. They hooked up everything, and unbelievable. Unbelievable staff I think you have.
Great.
Hospice of New York cares for patients facing a wide variety of life-limiting illnesses, including Alzheimer's disease, cancer, advanced pulmonary, cardiac, or renal disease, Lou Gehrig's disease, HIV/AIDS, and many others. Most patients receive hospice care in the comfortable, familiar surroundings of their own home, whether that is a private house or apartment, senior independent living, or assisted living facility. Hospice of New York also partners with over 50 nursing homes throughout the metropolitan area and Nassau County to assure that comfort and compassion are priorities for residents of these facilities. When symptoms make it impossible for a patient to be cared for at home, short-term inpatient care is available through contracted facilities throughout the Bronx, Brooklyn, Queens, Manhattan, and Nassau counties. When you choose Hospice of New York, you are choosing a team of dedicated professionals working together to bring the best care possible to your loved one. Each team member is available to visit the patient at home as specified in the individualized plan of care. The hospice team making home visits includes the hospice medical director, a physician who is board certified in hospice and palliative medicine, and a registered nurse who is specially trained in pain and symptom management. The team also includes home health aides, spiritual counselors, volunteers, allied therapists, and a medical social worker.
Hi, I'm Carolyn Parson, and I'm a medical social worker with Hospice of New York, and I've been working with Marie and her family for the past 2 months. Marie has benefited from the hospice services because she is more medically stable. With continued improvement, she hopes to be discharged from hospice if she no longer needs our services. She can be readmitted to the program in the event that her condition declines.
My name is Bob Gallagher. I am a chaplain with Hospice of New York. Spirituality at the end of life is extremely important to many people and to their families. Father Chris and I provide spiritual care to patients for Hospice of New York. We work together as a team, making sure that those who require pastoral care and desire it receive it. I would like to share an experience of a patient who was very memorable to me, a gentleman who lived in Harlem who was a very accomplished clinical psychologist. Initially, I started visiting this gentleman once a week, and then he asked if I could come more than once a week, which I did. I provided comfort and support to him at his bedside, and most of all, active listening and empathetic understanding. I was with this gentleman at the end of his life, and I attended his memorial service. This was a great privilege, pleasure, and honor for me to be involved in this gentleman's life. Hospice of New York provides bereavement services for 13 months after the death of a loved one. The reason that the service exists for 13 months is because we want to get beyond the first anniversary of the death of the person who passed away.
Marie talks about her health aid.
She comes in with a smile, which is most important early in the morning. And I'll ask her about her little girl, and the smile gets broader. And she asks me, do I want to get bathed first, or would I rather have something to drink first? What would I prefer to start? How would I prefer to start the day? Because I come in the morning, or come awake in the morning, O&R and pain, pain, pain. And she just alleviates all this. And it makes me feel, well, I have a choice in life what I want to do. So for a young girl, and she is, well, everybody's young beside me.
As a patient of Hospice of New York, your personal doctor may continue as your attending physician. Hospice of New York is never more than a phone call away. The on-call nurse is available 24 hours a day, 7 days a week. The services of Hospice of New York are paid for through Medicare, Medicaid, as well as most private insurance plans, including HMO and PPO plans. Most patients have no copayments or deductibles. Enrollment with Hospice of New York is easy. Simply call 718-472-1999 or 516-222-1211. When you have chosen Hospice of New York, you can rest assured that your loved one's wishes will be honored. To comfort always. It's the way we care.